Have you ever had a constant upset stomach that just never seems to go away? Or maybe a skin rash on certain parts of your body that are unexplained? Hi, my name is Samantha Dean, and my daughter is 6 years old and has always had digestive issues and dry, itchy skin on certain parts of her body. Google is one of my best friends. As much as I hate to admit it, this is the first place I go when searching anything. It's not always a good thing. After searching about these symptoms my daughter had and many more, I came across celiac disease. I'd only heard of this once many years ago, but didn't know much about it. I made an appointment with my daughter's pediatrician and we did all the tests and they came back positive. My daughter has celiac disease. Where do I go from here? In this presentation, I will go over what celiac disease is and how it affects us and how we learn to live with it. Celiac disease is a hereditary autoimmune disorder that affects primarily the small intestines. Celiac disease is caused by a reaction to gluten. Gluten can be found in wheat and in other grains such as barley and rye. When a person with celiac disease eats gluten, there are many abnormal immune responses in different organs, the main one being the small intestines. In the small intestines, gluten causes an inflammatory reaction and can produce shortening of the villi. This affects the absorption of nutrients. In kids, this can stunt their growth. For example, take an old pipe with goo and gunk built up around the sides. This is what the villi are in our small intestines. When you pour pipe cleaner down the old drain, it removes all the buildup and it's a nice smooth pipe. When someone with celiac eats gluten, over time it makes the villi get smaller and smaller to where they disappear. In a drain, this is a good thing, but in a person, these villi are needed for the absorption of food and nutrients in your small intestines. Many people live with celiac disease and never know it. There are over 200 symptoms associated with celiac disease. It takes most people several years to be diagnosed with celiac disease after their first testing, due to either one, they already started gluten-free diets on their own, or two, the symptoms are so widespread it can be related to other diseases, so they're tested for those first. Most doctors are able to diagnose this disease with a blood test, but the more accurate diagnosis comes from an endoscopy of the upper GI, or the upper gastrointestinal tract. This is where the doctor puts a scope down your throat all the way into the small intestines and takes biopsies from your esophagus, your stomach, and your small intestines. It's harmless and there is no pain afterwards. Due to celiac disease being an autoimmune disorder, it is also associated with a number of other autoimmune disorders, with the most common being thyroid disease and type 1 diabetes. If celiac disease is left untreated, it can lead to anemia, osteoporosis, infertility, dementia, different types of digestive system cancers, and many other serious health issues. When someone is diagnosed with celiac disease, it is recommended to have any first-degree relatives tested as well. These would be parents, children, siblings. While there is no cure for celiac disease, the only treatment is to stick to a strict gluten-free diet. A gluten-free diet improves the healthcare-related quality of life, but doesn't completely normalize everyday quality of life. People with celiac disease have to be very careful with what they eat. A tiny crumb can mess up their whole week, not just day. Some people are so sensitive to gluten that they can't even be in the same room with it. This is no easy feat. It is very hard to have to watch other people eat things that you have loved or you used to love and now you can't have. With my daughter, I try not to eat anything she used to like to eat when I'm around her. It's almost impossible to even go out to eat since some places advertise gluten-free food that truly isn't gluten-free, or the staff is not educated on what true gluten-free means. So if you ever have someone over that has celiac disease, don't be offended if they don't eat the food. It's not you. Food has to be prepared on a very clean gluten-free surface and not have touched anything containing gluten. This goes for serving spoons, even a fork. If it's dipped in something and then touches something a celiac person needs to eat, it can make them very sick. I've come across some people who don't take this serious, since eating gluten doesn't have the same reaction to someone, say, allergic to peanuts. No, eating gluten will not put you in immediate distress that needs medical attention, but it does damage on the inside that can cause bad long-term effects. While celiac disease is not the first disease most people are tested for, it affects more people than we even know. Testing is not hard, so if someone in your immediate family has been diagnosed, please get tested. According to the Celiac Disease Foundation, an estimated 1 in 100 people worldwide are affected, which means 2.5 million Americans are undiagnosed and are at risk for long-term health complications. There can be many lifelong consequences to putting up with the side effects of celiac disease. Let me finish by saying, when you hear someone say they have celiac disease or have to eat gluten-free, don't judge them. They did not choose this. Thank you. Does anyone